Good afternoon.
Hi, everybody.
Good afternoon.
Good afternoon.
This is Shantae speaking, town. I'm on. Hey, I think Lisette, that's our grant manager. I think that once she logs on, I'm gonna hop off because I still have participants to call. But I just wanted to make sure somebody was here.
Okay, no worries, but this session will also be recorded, so
Okay, thank
yeah.
you.
We will get started shortly. Okay, I wanted to check with everybody if you could see my screen. Maybe give me a thumbs up or a reaction.
We see it.
Perfect. Thanks, Nancy. Okay, perfect. Um, we will get started here. And if there are any questions, please put those in the chat. I can't see the chat from my laptop right now, so I'll have Kelsey and Annie monitoring the chat. But also, all of your questions from the chat will be wrapped up into our frequently asked questions document. So if they're not answered here, we will answer them as a team and have them posted on the website. So welcome. I'm glad that everybody made time today to attend our RFP solicitation and our bidders conference. So like I said before, please submit all your questions to the chat. We will have some time at the end for questions and answers. And also, the deadline for any other questions for this RFP is May 5th at 2025 at 5 p.m. And our session will be recorded for those that cannot attend, and it will be on the city's procurement website. If you need help navigating or finding that, you can reach out to one of us. I know my email address is listed on the RFP and many other places. So if you need to know what that is, please put it in the chat and we'll connect you. I wanted to introduce myself. I'm Tal Vanek. I'm the Director of Nutrition at the Chicago Department of Public Health, and I wanted to give Annie and Kelsey a chance to introduce themselves as well.
Hi, my name is Annie. I'm one of the regional nutrition coordinators with CDPH, and I oversee Henry Booth, Olivia, Asian, and then a few of the CDPH sites.
Hey everyone, I'm Kelsey Thor Larson. I'm the other regional nutrition coordinator, and I have the other half of our clinics. Welcome.
Thank you both. So the purpose of today is to really introduce everybody to the RFP. We're seeking proposals to provide WIC services to Chicago residents. And so as we know, WIC offers a no-cost support to our low-income, pregnant, breastfeeding, postpartum women, infants, and children up to age 5 who are at nutritional risk. We provide our supplemental foods, breastfeeding counseling, nutrition education, referrals to healthcare and social services. So a little bit of background about our program. So congrats, we have a 50-year legacy of celebrating WIC and bringing that to our communities and just really intervening on those public health indicators, making sure that there's a reduction of incidence of infant mortality, premature births, low birth weight, and aiding in the development of the child and improving the overall health status of women, infants, and children through all of our touch points and all of our partners. So let's just dive right into the RFP. So some of the scopes of the RFP, and you could see how this is outlined if you have the document in front of you. We have recruitment and assess eligibility. So that's about our core services, looking at just our making sure they're an eligible population, if they meet our requirements, and making sure that people that are adjunctively eligible have an expedited pathway to services. We also want to provide high quality services and promote retention. So as we know, we can see some steep drop-offs in our WIC population as they age. I know the second birthday becomes hard. So how do we find creative ways to keep people on the program? Also, innovative approaches to service delivery. We recognize that everybody can't come to a brick and mortar clinic, whether that's because of hours of service or it may not be in their neighborhood or on their transit pathway. And so how do we bring services into the community and making a touch point at a Head Start or at a daycare so people could stay on the program and we could promote more retention? And then, of course, participating in CDPH collaboration as we have initiatives and we're looking to develop across programs. I know something we've been talking about lately is safe sleep, but making sure that you're a strong collaborator with CDPH and our other public health initiatives that touch our prenatal space. So the total funding we have available is on the screen. The source of these funds is that it's a pass-through grant, so it comes from USDA, it goes through the Department of Human Services, it comes to CDPH, and then at this point, we're subcontracting to agencies in the community. Contract information, there will be up to 5 delegate awards available. The initial contract period will be 36 months, so that's 3 years, and then there's going to be up to 2 extensions. We recognize that you can serve somebody at your WIC clinics for up to 5 years and 9 months if they come in during their first month of pregnancy. So we want to create that continuity of services and also reduce the administrative burden on reapplying so often. And so how does this touch our health equity and our Healthy Chicago 2025? So part of our strategic plan in Healthy Chicago is to modernize the WIC program through strategies to maximize utilization. We want to conduct outreach to eligible households that are not currently enrolled. We want to support innovative approaches to service delivery. Here's some more examples: mobilization, providing hours of service outside of regular business hours, and then expansion of community partnerships. And then we have some of our CDPH guiding principles. So making sure we're providing trauma-informed and culturally responsive services. I know we all currently use the language line or find things that are both culturally and linguistically appropriate to serve our population. And also we want to center on health equity and race equity, so ensuring that equitable access for our families from diverse backgrounds, targeting our outreach to underserved communities. We want to reduce food insecurity through this program and provide other referrals to healthcare. So in our community areas, we just aim to balance that continuity of current services and making sure that we're promoting access in our communities with lower concentrations of enrollment. So here's just a breakdown of some of the scoring and evaluation. You can see that the points do vary. I just want to point out at the end, at the project description, this is pretty heavy because this is how the applicant will render services and meet the objectives of the RFP. So knowing that, we want you to spend a lot of time in project description of how you see this program operating in your agency. And I thought this was important to just highlight these important dates. So our RFP was released last week on 4/24. Today is our bidders conference. And there's a deadline for questions on May 5th at 5 p.m. Now the response is due for the RFP, so your application packet is due on May 26th. And please note it's due at noon Central Standard Time. And so the contract start date, that will align with the state fiscal year of July 1st. And then you'll see the contract end date of that 36-month period. And then this is just highlighting below about the 2 contract extensions, each not exceeding 1 year at the discretion of the city based on availability of funds, the need to extend services, and the respondent's performance. Some of the eligibility requirements to apply. So we would like you to have an office that's located in the city of Chicago, which the agency is offering services. You have to be in good standing with the city of Chicago, and also have the administrative, organizational, programmatic, information technology, and fiscal capacity to plan, develop, implement, and evaluate the proposed project. Agencies with limited capacity to administer the fiscal responsibilities associated with their programs must choose to subcontract with a fiscal and reporting agency to provide administrative services. So how do you access the RFP? So you can download it if you use this link. You can also Google it. So if you say City of Chicago WIC RFP, you could look at the email that I sent to click on it and it will bring you right to it. So respondents are required to have internet access and an email address. The city will not provide any hard copies of the RFP or clarifications or addenda. So respondents are required to submit responses via the city's online procurement system, e-procurement. Some other information about accessing this RFP. You do not need a login to the city's iSupplier procurement portal to access the RFP. It's available to everybody. If you do need a login on the city's iSupplier procurement portal, because you will be submitting your organization's application, only someone from your organization can grant you access. So if you need iSupplier access or something's going on with that, please email me and we'll connect you with the appropriate contact to make sure that you have access. And do that sooner than later, just so we can ensure that you do gain access and you can meet the deadline. So these are some requirements. I know that we get so wrapped up in the RFP and sometimes we forget about the additionals. So I want to just make sure we highlight the additionals so they're not forgotten about. So applicants are asked to ensure they submit all of the required components to ease the review and evaluation of applications. So make sure you submit your budget, your work plan, your staffing plan, in addition to your responses to the RFP. Fiscal capacity. So payments for services will be made on a reimbursement basis. Respondents must demonstrate capacity to fund program expenditures from the start date until they are reimbursed by the city. So making sure that you have enough fiscal capacity to take on staffing, to take on salaries, to take on needs of the program in order to, stabilize so we can reimburse you on a timely basis. Little more information about RFP and submission information. So RFP and submission information is on the e-procurement system. To complete an application for the RFP, respondents will need to set up an account on e-procurement. So some other things that we need. So all vendors must have a federal employee identification number, that's the FEIN number, and an IRS W-9 for registration and confirmation of vendor business information. So if you're a new vendor, you got to register with the city's procurement department. Existing vendors, you may request an iSupplier invitation via email if your organization does not have an iSupplier account. And then for further e-procurement help or use of contacts, I put the email right here in the blue bar. But you could refer them to us as well, and we'll make sure you get connected to the right person. I wanted to re-highlight these important dates. So if somebody wants to take a screenshot, you want to get your phones out just to make sure you have them, or you want to write them down one more time. I wanted to just remind us, these are also on the website where the RFP is available, but I wanted to make sure everybody had the correct information and is noting that noon deadline for responses.
Hey, Tal, we have a question in the chat.
Sure. I'm gonna minimize this so I can see.
Okay. The question is, can you elaborate on the planned portion of the proposal? Are you referring to us explaining current and future partners, outreach, etc., to meet caseload and provide services?
So Shante, we could give you a more elaborate answer when we respond to this question officially for an FAQ, but we can go a little into it. I will also at this time, I'm working between screens, so let me pull up the RFP to quote so we can answer your questions. It's kind of difficult to work from one screen today, so Getting there, Shantae.
No rush.
Yeah. Do you have a copy of the RFP as well? So I will highlight from page 8 and I'll
Mhm.
just, but I'll just read some of it and then we could put some context around it. So some of the innovative approaches to service delivery that we're looking for is really outreach spreading. So spreading that word of mouth on print materials, social media, local advertising, grassroots connections. Families with SNAP, TANF, or Medicaid Part 19 are adjunctively eligible. So making sure we're doing outreach. Some mobilization, so taking WIC services out of the traditional clinic setting and into the community by partnering with trusted community organizations. More families can be reached as where they gather, making it easier for families to stay on WIC. And then we also are talking about partnership. There's a priority from DHS to have more MOUs, which are memorandums of understanding, with local Head Start agencies, and also just working relationships with organizations that are in the maternal and prenatal space, maternal and infant organizations, such as healthcare providers, early childhood centers strongly align with our prioritized populations. So making sure that we're coordinating connections, and whether that's, hey, dropping off WIC flyers, maybe that's, can we get a shared spreadsheet if somebody's interested in WIC and they want to sign up or they have a question about coming back to WIC. And then also we're looking at like modernization practices. So how do we use technology to increase our efficiency and reduce burden, and just some of your ideas around that.
Okay.
Did I answer it,
Yeah.
Shantae?
Yes, you answered it because I did start on it. And when you emphasized that part, I'm thinking like, well, did I touch on that stuff? So you explained it right. Thank you.
Okay. Thank you for your question. See the next question. To confirm the amount of the budget we are submitting. So you can submit the budget at which the amount that you're requesting. So whether that's your current funded amount or if you're requesting more or less in a case, you can submit that amount. I think it is a good baseline to submit a budget for the amount that you received last year. But also because it is an RFP year, if you have goals of expansion, more staff, maybe adding in some new technology, you are welcome to include that and we will review as a team. I see somebody else typing, so. If anyone wants to ask a live question, they're also invited to do that as well.
This is Korea Allen. Thank you for that response because in the past, they gave us the amount that we needed to submit the RFP for. So it's been my experience that we would submit for, as you said, what our needs are and then see where it lands. But
Yes,
yeah. Thank you.
you're welcome.
And I have another question. I don't know if it relates back to this, Tal, but I know the last in-person delegacy meeting, we talked about like the hemoglobin machines, the Moss, if I'm pronouncing it right. So
Yep.
if I'm thinking about wanting to see if we can get those, this would be a time to add it in there. Okay, thanks.
Absolutely. And I would also add in the maintenance cost of it because you got to buy the strips. every so often.
Okay, thank you.
You're welcome.
Hi. If we're expanding, we already serve many people with the program. If we're expanding to a new site, in terms of the additional MOUs and other evidence of partnerships in the area, is there like an expectation of like how many partnerships or anything akin to that to show the strength of our, since we don't have like a presence in there per se, physical presence yet, to show enough of a relationship to the area?
Yeah, we didn't come down with a concrete number, but I think what we're really looking is like some diversity in those partnerships. So, maybe you're working with a place that serves women and then another place with children, but just to show that you're reaching out to serve people at different priorities in WIC. So not only the pregnant, the postpartum, and the breastfeeding women, but also all those ages of children. So
Thank you.
other questions or clarity we could add for you? Okay, well, thank you for attending today's Bidders Conference. We are super excited to see your submissions, and let us know if you have questions or need support within the process. We can ask, I have my phone number and my email on, so please make sure you reach out and we'll respond timely. So
Thank you.
thank you. Thanks.